Today, we're delving into the mysterious language of your body. It sends signals, and some of them are downright surprising. Stay tuned as we uncover 10 crucial body signs that you might not have thought twice about. So, are you ready to listen to what your body is trying to tell you? Stay tuned as we delve deeper into each of these signs and what they could mean for your health. Let's commence our journey by investigating the first of 10 physical indicators: unexplained weight loss. Ever thought that shedding a few pounds without even trying was a good thing? Think again. Best case scenario, unintentional weight loss is typically concerning, often associated with conditions like Crohn's disease, a serious but usually not fatal ailment hindering nutrient absorption. Alternatively, if increased urination accompanies the weight loss, it might indicate type 1 diabetes, which can occur at any age. This condition prevents cells from receiving necessary sugar for energy production, prompting the body to burn fat and muscle, resulting in unintended weight reduction. Potential severity. When unexplained weight loss exceeds 10 pounds, it could signal an initial indication of cancer. Frequently linked to pancreatic, stomach, esophageal, and lung cancers, the energy-draining nature of cancer cells may elucidate the sudden drop in weight. If your weight has decreased by at least 10 pounds in the past 6 to 12 months without alterations to your diet or activity levels, especially if you possess risk factors like a history of smoking, consult your doctor promptly. Now, let's examine the second sign: achy Achilles heel. The Achilles tendon, a robust, fibrous band connecting the calf muscles to the heel bone and situated at the back of the ankle, can manifest pain as a symptom of psoriasis. The National Psoriasis Foundation notes that psoriatic arthritis, a form of tendon pain associated with this skin condition, may also present as swollen, sausage-like fingers and toes. To alleviate such discomfort, a doctor might suggest the use of over-the-counter pain relievers. Next, sign number 3. Thinning eyebrows or hair loss in that area might indicate the presence of hypothyroidism, a health condition characterized by insufficient production of essential hormones by the thyroid gland. This condition is more prevalent in women over the age of 60. Additional symptoms encompass sudden weight loss, erratic or accelerated heartbeat, as well as increased sweating, nervousness, or irritability. Stay tuned because we still have more bodily signals to decipher. On to sign number 4, a decline in sniff ability. Losing your sense of smell might be one of the first signs of Alzheimer's, a sickness that affects the brain. In a study, mice that were made to have a lot of a protein called amyloid precursor protein, related to Alzheimer's, had more nerve cell death in their noses than regular mice. The changes in your sense of smell because of Alzheimer's are like changes that happen in other parts of the brain, but they show up earlier. It's normal to lose your sense of smell slowly after you turn 70, but if it happens much earlier or really fast, talk to your doctor about it. Let's move on to sign number 5, redness under your fingernails. Normally, nails exhibit a smooth and blemish-free appearance. However, if you observe redness beneath your fingernails, it may indicate lupus, a condition where the immune system targets healthy tissues. Lupus can additionally manifest as a rash on the dorsum of your hands and fingers, accompanied by swelling and puffiness at the nail base. Next, number 6, dragon breath as a sign of erectile dysfunction. Foul breath, often referred to as dragon breath, can be an indicative signal of gum disease, a condition that might be associated with erectile dysfunction. A study conducted by Turkish researchers revealed that men aged 30 to 40 with severe gum disease were over 3 times more prone to experiencing erection problems compared to those with healthy gums. To counter this, make the strategic move of brushing your teeth twice a day, engaging in daily flossing, and ensuring biannual dental checkups to maintain optimal oral health. Let's delve deeper to warning sign number 7, excessive thirst. Maintaining proper hydration is beneficial, but persistent thirst could signal an underlying health issue. In the case of diabetes, heightened blood sugar levels induce excessive thirst as the body attempts to eliminate surplus glucose. Regular blood tests are essential to monitor glucose levels and detect potential insulin deficiencies associated with diabetes. Additionally, unexplained thirst may be indicative of conditions such as internal bleeding, infection, or organ failure. It's crucial not to disregard this significant symptom and seek appropriate medical attention. Jumping to sign number 8, sweet cravings. Craving chocolate, donuts, or cookies? It's likely a sign of dehydration. When your body lacks adequate hydration, the release of glycogens, crucial for providing energy, becomes challenging. Consequently, food cravings, especially for sweets, may arise, particularly after a workout. To rehydrate, opt for snacks with high water content, such as fruits and vegetables, or choose beverages with electrolytes. Additional indicators of dehydration encompass heightened thirst, fatigue, dry eyes or blurred vision, headaches, muscle cramps, diminished sweat production, dark urine, fever, and dry, shriveled skin. Moving on to sign number 9, vivid dreams or nightmares. You might be expecting a baby. Although the exact reasons are unclear, some pregnant women mention alterations in their dream patterns during pregnancy. This shift could be attributed to changes in hormones and sleep patterns, as pregnant women often find themselves needing more sleep than usual. And lastly, sign number 10, sudden onset of kleptomania. A sudden unfamiliarity with the law and a desire to steal something minor, even when one can afford it, may be an initial indicator of dementia, especially for individuals who have been law-abiding throughout their lives. Unfortunately, conditions like dementia can manifest subtly, making it challenging to acknowledge the issue, let alone seek assistance. It's crucial to monitor oneself closely and pay attention to elderly relatives. Those with dementia may not be aware of their condition and require our support. When seeking help, consider consulting various behavioral experts, as the issue may be either physical or psychological. Schedule an appointment with a neurologist to assess signs of dementia and consult with a therapist or psychiatrist to acquire cognitive behavioral techniques for managing sudden urges to steal. If dementia is diagnosed, adhere to the doctor's guidance to minimize its impact, and don't hesitate to seek assistance, even if it seems unnecessary. Have you experienced any of these signs? Share your thoughts and experiences in the comments below. And if you found this video helpful, don't forget to give it a thumbs up, subscribe, and hit the notification bell for more health tips. Stay healthy, everyone!